Okay, so the first thing I'm gonna do, I'm gonna go in the med room, wash my hands, and I'm gonna do my first 2 checks. So I have my medication in hand. Okay, I'm gonna do my first check. So I have Susie Q Sick Girl. Susie Q Sick Girl, her date of birth is 1/1/50, 1/1/50. She has an allergy to penicillin. And I'm looking down her MAR and I see no penicillin prescribed. Okay? Now I'm going to do my normal saline, 0.9% normal saline, 0.9% normal saline. It is to be given 125 milliliters per hour continuously, and I have a 1,000 milliliter bag, so I'm safe. It is to be given intravenously, and this bag can be given intravenously with tubing. It is to be given at 8 a.m. to 7:30 a.m. Okay, next I'm going to check and make sure that the bag is clear, it's not cloudy, there's no precipitate, and it's not expired. Everything is looking good on the bag. The medication is looking safe. Now I'm going to go into my second check. For my second check, I'm going to do Susie Q Sick Girl. Susie Q Sick Girl, date of birth 1/1/50, 1/1/50. She has been prescribed 0.9% normal saline, 0.9% normal saline. It is to be given 125 milliliters per hour continuously. Now, looking at my packaging, I see I have a drop factor rate of 10, so I'm going to set that formula up. I'm going to do 125, my order, times 10, then divide that by 60, and my drip factor rate is 20.8 with 3 repeating. I'm going to round that up to 21. Okay, that's looking good. And it is to be given intravenously. I can give this intravenously through the port. It is to be given at 8 a.m. and it is 7:30 a.m. Okay, now I'm gonna work to set up my solutions. So on my second check, I'm going to get my tubing, open my tubing, and the first thing I do when I open my tubing, I'm gonna close the clamp on it, and then I'm gonna spike it. Okay, so I'm gonna take that off, and then that. Okay. Now my tubing is spiked. And before I forget, I'm going to get a piece of tape, and I'm going to label my bag and my tubing now on my second check. So for my bag, I'm going to label that with an up arrow. My initials, the date, the time. Yeah, up arrow, my initials, the date, and the time go on my tubing for my bag. And my bag is already pre-labeled with my patient's information. So I'm not going to put it on right quick, but for my tubing, for my wire, for my label for my tubing, I'm going to put the date, the time, and my initials. And that's for my label for my tubing. And I'm going to just set that off to the side for now. Put that on after I prime my tubing and prime my Y sites. So now onto my tubing. I am going to first fill the drop chamber 1/3 of the way full. Then I'm going to open the chamber and I am going to prime my Y sites. Okay. Okay, now I'm going to clamp my tubing. Okay, my tubing is now clamped. and my tubing is primed. My Y sites have been primed. I flipped the chambers to make sure everything got in. So I'm going to grab that label I made for my tubing. I'm going to put it in. Okay, so now before I go into the patient's room, my solution is set up. I've done my 2 checks. I've labeled my bag. I've labeled my tubing. I've primed my solution, primed my Y sites, and now I'm ready to go into the patient's room. So now that I'm in the patient's room, the first thing I want to do is the first 5. So wash my hands, introduce myself. Hello, my name is Jamie. I'm a Hack nursing student. Then with my MAR, I'm going to compare to their wristband. What's your name and date of birth? Susie Q, sick girl, 1150. Okay, I see that. And do you have any allergies, Miss Susie Q? Yes, I have an allergy to penicillin. Okay, I see that noted on your MAR. And I'm going to close the curtain for some privacy. Okay, Miss Susie Q, what I'm going to do today is administer your 0.9% normal saline that is to be given 125 milliliters an hour continuously. Is that okay? Yes, that's okay. Okay, so now what I'm going to do, I'm going to do my 3rd check before I start. So grabbing my MAR, Susie Q, sick girl, Susie Q, sick girl, date of birth 1150, 1150. I see you've been prescribed 0.9% normal saline, 0.9% normal saline, and 0.9% normal saline is labeled on my bag. On that bag, I have it's ordered 125 milliliters per hour continuously. And through my calculations that I did on the 2nd check, I know that you have a drop rate of 21 drops per minute, and you have 1,000 milliliter bag, so that all works out. It is to be given intravenously. You have a bag set up to be given intravenously and tubing. It is to be given at 8 a.m. And it is 8 a.m. now. So I'm in my patient's room on my 3rd check. So now what I'm going to do, I'm going to don clean gloves, and I'm going to assess the site before I start flushing it and all that. So I'm going to look for infiltration. I'm going to look for phlebitis. So with infiltration, that basically means that the tissue is perfusing or going into the tissues. So what I'm going to be looking for at the insertion site is swelling, if there's any pallor, coldness, or pain. I'm also going to be looking for phlebitis, which means that there's going to be inflammation at the insertion site. So it's going to be tender, it's going to be red, it's going to be warm, and again, it's going to be painful. Okay, if I see any one of those, I'm going to discontinue the IV immediately, but I don't see that in my patient, Miss Susie Q, so I can continue on. Again, I still have my clean gloves on, and what I'm going to do, I have this little pullover clamp. I'm going to make sure that the pullover clamp is open so that I can get in it. I have my solution, and I'm going to flush it. So first, what I'm going to do, I'm going to get an alcohol swab, and I'm going to scrub around, scrub for 15 seconds. Once that's scrubbed, I'm going to hold this up, and I don't want to put it down because I want it to maintain sterility. Then I'm going to take out this. And I'm going to flush with 3 milliliters of saline. And while I'm flushing, I'm going to state how it flushed. So flush with 3 milliliters. Okay, throw that away. And if there was no pushback or anything like that, it just very easily flushed into the site. Okay, I'm going to put this down, which means it is no longer sterile. Okay, now I'm going to get my tubing. I have my tubing, which is clamped on my IV pole. Okay, now I'm going to go and I'm going to pick this up. I'm going to get another alcohol swab because since I had to put it down on the skin. And I'm going to scrub with my alcohol swab. And what I'm going to do now, finagle this, it's going to go sterile to sterile. Sterile to sterile, okay. Now everything is on. So what I'm going to do now, I'm going to set my drip factor rate. This one. Okay. So it's to be given 21 drops in a minute, which means I want to count for 15 seconds to make sure I get 5 or 6 drops in 15 seconds. And then I want to count for a whole minute. So I'm going to slightly open my clamp. And I'm going to count for 15 seconds. Okay, and I got 5 drops in 15 seconds. So now I'm gonna go back and count for a full minute. Now, if I would have gotten more or less, I'd have to readjust my sliding clamp to make sure I got 5 or 6 in a minute. But I got exactly 5, so now I'm gonna count for a whole minute. And I'm just gonna simulate that, but I would count for a whole minute. Okay, I got 21 drops, my drip rate is set. And now what I'm gonna do, I'm gonna make sure I'm still eyeballing this to make sure everything's going, there's no kinks or anything like that in the wiring. And what I'm gonna do, I'm gonna lower my patient's bed to a comfortable height, take off my gloves, wash my hands, and document.